Hi everyone. Hi Emma. This is Lymphedema Training Academy, and we're focusing this year on Lymphedema Awareness Week. We're focusing on the things that we don't say, and I'm really grateful that we've got Emma here today, Emma Winchester. She is a lymphedema and also a women's health specialist, and she's going to support us with some of those difficult questions that we may have. So welcome, Emma. Thank you for coming today.
Hi,
I
Jane.
Oh yeah, I suppose the first thing is that we think about cancer patients and the types of treatments that they've been exposed to, that they've gone through. Have you been approached with any specific questions from women in particular, and the answers that you may select and provide them with, help them with?
Yeah, so women often come into the clinic post cancer treatment, and they might be on hormone therapy or have had radiation therapy. And so they're experiencing some changes in their tissues, which are often can be distressing for them, and they're not sure what to do about it.
Yeah,
So we've got, if they're on hormone therapy, they might have early menopausal symptoms
yeah,
that they maybe weren't aware of how they actually might feel or what actually that would involve. So they could be experiencing the hot flashes, night sweats, joint pain, sleep disturbance, those things that we typically associate with menopause. But alongside that, what some many women don't expect to experience is, for instance, the vaginal kind of dryness and the soreness that comes with that kind of lower estrogen, where the tissues get a bit thinner and they get a bit more fragile.
yeah. And that's important as well, isn't it? Because many of our ladies will have had brachytherapy, so that can be internal radiotherapy, either vaginally or rectally or localized on the tissues as well. What types of problems does that bring?
Often that can bring that scarring within the tissue and that kind of fibrotic, firmer tissue. So the tissue loses its elasticity, and you can get narrowing, and it can be uncomfortable to be intimate and have intercourse because the tissue just doesn't stretch in the same way that it used to. Alongside that, a loss of lubrication, so that can make it feel less comfortable. And so people get they kind of get fearful of having intercourse because of how it's going to feel and that it might not be comfortable. And alongside that is the thought of how will their partner perceive them, and their changed body. Will it be noticeable to their partner? Will it be uncomfortable for their partner as well as themselves?
Yeah. I think that's really important. And with lymphedema, what comes with that is also the shortening of the vagina sometimes, and that
Yeah,
maybe women don't know that following that cancer treatment, they may be using a vaginal dilator to try and prevent that
yeah.
stricture and keep that comfortable for them. And that's a difficult conversation to have with partners as well, isn't it? That this is what I'm doing as part of my treatment. And I think the other thing that we sometimes see with the genital lymphedema is the changes of the skin, that fibrosis, where you get papillomatosis and you get like lymphatics and little bumps on the skin, which can be very uncomfortable and as a source of infection during intimacy as well. Right.
Yeah, and often people are concerned about the appearance of that, that looks like.
Mhm.
Those kind of like slightly warty like structures. We kind of associate that with not so nice issues with our down below. So
Yeah.
you kind of it's sometimes got some negative connotations with those like cauliflower kind of like growths. So I think people are really concerned about the appearance.
Yeah, and you're absolutely right. And I think that today really is a short session, but just to say those people who are developing that, or they're thinking that something is altering down below, or they're getting experiencing any problems, intimacy, or being plunged into different hormonal changes, that please do reach out, have the courage and fight the fear, as you said earlier, also to talk to a healthcare professional, your lymphedema therapist, a health physiotherapist like yourself, women's health physiotherapist, so essential. And ourselves as well, we're here for that. So I want to thank you for the time for helping us put a highlight on this in Lymphedema Awareness Week. So thank you very much for your time.
Thanks, Jane.